Welcome friends. Are you linked with medical profession? Do you deal medicine in your workplace? Do you know how to handle high alert drugs? Do you know what is high alert drugs? In this video, I will discuss all about high alert drugs. The discussion includes definition of high alert drugs, importance of making the list of high alert drugs, and then problems associated with high alert drugs, that is risk factors, and strategies to avoid errors involving high alert medication, and then how to store high alert drugs, and last but not the least, patient education. Some medications have a very narrow safety margin and can cause severe patient harm when implicated in an adverse event. The consequence of an error associated with the use of this medication can result in significant patient injury. These medicines, which may bear heightened risk of patient harm, is known as high alert medicine. Importance of making list of high alert drugs. Medication errors are significant and often preventable healthcare problems. Although many medication errors may not cause serious harm to patients, but the high alert medication do so. To ensure safe medication practices and to eliminate medication error that cause harm to patient, a list of high alert medicine should be identified for a healthcare system from small primary to tertiary hospitals. The Institute of Safe Medication Practices recommends that high alert medicines should be packed differently, stored differently, prescribed differently, and administered differently than others. Common risk factors associated with high alert drugs. Number 1. Confusion about the strength of the drugs or medications. Number 2. Confusion about the routes of administration, that means which route, whether it is intramuscular or intravenous, etc. Then look alike, sound alike product and similar packaging. Number 4. Incorrect dilution procedure. Number 5. Wrong infusion rate. And number 6. Poorly written medication error. List of high alert medicines. Number 1 category, adrenergic agonist, as for example adrenaline, noradrenaline. Adrenergic antagonist, as for example propranolol, labetalol. Number 2 anesthetic drugs, for example propofol, ketamine. Number 3 anti-arrhythmic drugs, for example amiodarone, lignocaine. Then antithrombotic agent, for example warfarin, heparin, tenecteplase, streptokinase. Number 5, the category is antivenom. The example includes cobra, pit viper antivenom, etc. Then number 6, ionotropic medicine, that means which increase the rate and force of contraction of heart, which includes the example digoxin, dopamine, dobutamine. And number 7, neuromuscular blocking agents, as for example atracurium and pancuronium, etc. Let us take few more example of high alert drugs. Number 8, chemotherapeutic agent, that means all anti-cancer drugs. Then number 9, hypertonic solutions. It include all the parenteral and oral dextrose solutions of greater than 20% concentration and sodium chloride more than 0.9% solution. Then number 10, opiates and narcotics include tramadol, barbiturate, diazepam, etc. Then number 11, sedative and hypnotics including diazepam, alprazolam, clonazepam, etc. Then number 12, total parenteral nutritions, all the product in this class. Then number 13, anti-hyperglycemic medications that is anti-diabetic medications include injection insulin, maybe in subcutaneous or IV route both. And number 4, the miscellaneous, which include injection potassium chloride, injection magnesium sulfate, all the hemostatic and antifibrinolytics drugs. Strategies to avoid errors involving high alert medication. Number 1, high alert medications will be prescribed, dispensed and administered using practices that are proven safe. Number 2, high alert medicines must be labeled as high alert medicine everywhere on container, product package, storage shelf, loose ampoule or vial, and in unpacked or open packages. Number 3, it must be double checked before dispensing or before administration to the patient. Number 4, any changes in brand or color or preparation must be informed to the users as soon as possible. And last but not the least, all staff involved in the handling of high alert medicines should be educated on this guideline. How to store high alert medicines? Number 1, label all the container, packages or shelves as high alert medicine. Second one, all personnel must read label before storing to ensure medicines are kept at the correct or right place. Number 3, look alike, sound alike drugs and different strength of the same medicine should be kept in different places and must avoid keeping side by side. Number 4, use Tallman lettering, that is, first few letters should be in capital to emphasize differences in medication names. As for example, dopamine and dobutamine, the first 4 letters of dopa and dobut must be in capital. Patient education. Educate patient and family members on following points. Number 1, educate patient on name of the medication and its purpose of use. Number 2, how much and when to take the medications. Number 3, how to take the medications. Number 4, common side effects associated with high alert drugs given to them. And number 5, what to do if they miss any dose, that is, alert them not to use multiple doses at a time.